Hello everyone. Today is a special day. Today is World Homeopathy Day. So I congratulate you all on this auspicious occasion. This is the day when you should visit take your time and visit the life history of Hahnemann. Uh, Actually, what should be our method of reading the life history of all the great men is to choose their birthday and go through their autobiography. At least for that day, I used to do this every at every birthday of the great men I know and admire. Like on 2nd October, I used to read my experiment with truth every year on uh, like um I think it is the best way to go through the philosophies they have propagated, the life they have lived, the message they have sent. So today is the birthday of Hahnemann, and it is the today is Sunday also. You can take your time to go through a bit of life history of Hahnemann's, and Hahnemann's life history is you cannot read Hahnemann's life history without reading the development of homeopathy, history of development of homeopathy. In the very initial lectures, we have approached the we have approached the development of history in this fashion also, and some of you have made a chart also with the life history of Hahnemann and the development of homeopathy from 1783 when he left practice, 1783 and up to 1790. This period I called the period of conception. The somewhere inside Hahnemann, the homeopathy was being conceived. He was being dissatisfied with the present scenario of medicine at of his age. He was trained in allopathy, uh, and he grew dissatisfied and he left practice, and that dissatisfaction and desire to change led Hahnemann to discover homeopathy in 1790. From 1790 onward, you will see side by side the life history of Hahnemann and development of homeopathy. You will see the change of places in Hahnemann's life. He went from Leipzig to Cothen to Paris, and before that he was living here and there in small towns before Leipzig era, 1811. Before Leipzig era, he was living here and there in the small town in order to reduce his expenses on daily life. So he moved to Leipzig in 1811. From Leipzig, he was in Leipzig. He was enjoying his life. He was teaching his, propagating his new system of medicine. He was teaching and seeing patients there. But the problem in Leipzig happens with the apothecaries, the pharmaceutical personals who opposed Hahnemann of dispensing his own medicine. So he have to left Leipzig and went to Cothen. There in Cothen, a long period of what you will say, a long period of peace happened with Hahnemann, and he was more being pondered upon the philosophies of homeopathy. And you will see here in this period, in the period of Cothen, he discovered the theory of chronic disease. He propagated theory of chronic disease. If you remember, the theory of vital force came in 5th edition. Theory of chronic disease came in 4th edition, that is 1828. And many more novelties. The dynamization, theory of dynamization came here only in Cothen period. So you will see that some people have correctly said that Cothen was the Makkah of homeopathy, and some people out of their biasness told that it is nothing but the romance of homeopathy. Till Leipzig period, Hahnemann was okay in his senses. Till Leipzig period, Hahnemann was perfectly okay with his senses. But as he was aging down, he started to fill up the homeopathic system with rubbish. So this is one set of opinion you will get, and other set of opinion that Cothin was the most reproductive part of Hahnemann's life, where he have established his system as perfect and further polished it during the Paris life. Okay, so this is a brief narration of Hahnemann's life. You can go through the Hahnemann's life. Two books we have referred earlier. One was Burnett's Ecumedicus, a small booklet. You will get it online PDF free of cost. Other book is the Richard Hughes Medical Philosopher. It is also on Hahnemann's. Other book I will refer. There are books like Richard Hell's Life and Life History of Hahnemann's by Richard Hell, and there are other books by T.L. Bradford, Life and Letters of Hahnemann. Okay, these books are a bit thick. Richard Hell's book is coming in 2 volumes. It is not wise to go through because you won't be able to digest it at first. So read some small booklets first, then go to the bigger one. T.L. Bradford's Life and Letters of Hahnemann, and Richard Hell's book is Life and History, like that. 2 volumes of Richard Hell's book is there of Hahnemann. And other book I will refer beside those 2 books which I have referred earlier, that was Ecumedicus of Burnett and Richard Hughes, not Hell's, Richard Hughes' book Medical Philosopher. Other book I will refer is Wobhouse. This book, Rosa Wobhouse, Life of Christian Samuel Hahnemann. This book is one of the important book and easy book. After you have gone through those 2 books, rather booklet, I will suggest go through this book. This book is also covering, actually one of the important thing about this book is it is covering the life history and development of homeopathy in years. Like you will get the Paris years, the Cothin year, the Leipzig year, like that, and very easy book to go through. So this was all about history of Hahnemann. If you want to repolish your history of homeopathy and life history of Hahnemann, go through some initial lectures where I have given you task also to establish the life at one table, and one part establish the life history of Hahnemann, and other part of the table establish the development of homeopathy. Like in 1897, when Hahnemann saw the first time saw the homeopathic aggravation, 1897, with Veratrum album, a case of colicodynia which was aggravated due to wrong dosing of patient, and he was so aggravated that it was near to death experience for the patient, and Hahnemann learned to minimize his doses, so to minimize the homeopathic aggravation. So go through some initial lectures, I think lecture number 2 or 3, and you will get the development of homeopathy and life history of Hahnemann. Actually, it is important to make interesting, make this part, this philosophy part interesting. Okay, to know some bits and bits of life of Hahnemann, that what he was doing in Leipzig. Actually, in Leipzig here, he started to teach. If you remember that, he got a professorship in Leipzig University. For getting that, he wrote a dissertation on Veratrum album, Hellebore of Ancients. Okay, this thesis he has defended in front of faculty members of University of Leipzig. Then he was allowed to give classes to students. There he gets a number of students, number of followers, and with them he started the proving. Before he was doing proving with his family members, his friends. Now he are getting some dedicated bunch of followers who will help him to prove other medicines. That is why we are getting Materia Medica Pura in the first volume of Materia Medica Pura in the Leipzig period. Okay. So Leipzig period ends in around 1821. Till then, you will see that three editions of Organon have already been published, and fourth edition was coming in Cothen in 1829. Before that, 1828, chronic disease published. Okay, and research on chronic disease started in the period of Leipzig itself, because Hahnemann was facing some difficulties in treating cases, that it was relapsing again and again. So this much for the history of development of homeopathy and life history of Hahnemann. Now come discussing, we have discussed the introduction of mental diseases. Today we will go on from 215, aphorism number 215. Have your book with you and read aphorism number 215, which is the definition. You can write the definition of mental disease. Okay. In the last class we have given introduction to mental disease and why mental symptoms are important in our prescription and how to use them. Now today we will start from 215, which is basically dealing with the definition of mental disease. All the so-called mental and emotional diseases are nothing more than corporeal disease, in which the symptoms of derangement of mind and disposition peculiar to each of them is increased. Here Hahnemann is separating mind and emotion. Okay, mental disease and emotional disease. So which is the symptoms of it are increasing, and the physical symptoms, the symptoms of corporeal disease are decreasing. Derangement of the mind and disposition peculiar to each of them, peculiar to mind, peculiar to emotions, while the corporeal symptoms decline more or less rapidly. Okay, one is increasing, other is decreasing. We have told that mental diseases are nothing but the one-sided disease of mental nature. We have divided one-sided disease into internal and external. We have divided internal into physical and mental. So we have dealt with the physical one-sided disease. Now mental one-sided disease. Okay. So mental one-sided disease means there are physical symptoms less in number, and the chief symptom here is the mental or emotional symptoms are chief. Till at the length attains the most striking one-sidedness. Okay. Almost as though it were a local disease in the invisible subtle organ of the mind or disposition. Okay. So this is the definition up to this underline. More or less rapidly. This will be the definition. Okay. 216. 216. The cases are not rare in which so-called corporeal disease that threatens to be fatal, example, a suppuration of the lungs or deterioration of some other important viscous or some other disease of acute character, that is in childbed. You will see the mania of childbed, that postpartum psychosis. Okay, all of a sudden postpartum symptoms decreases and mania occur. You will see this postpartum depression, postpartum psychosis. We have seen during our internship duty at one of the maternity hospital. We have seen patients of postpartum depression, postpartum psychosis, where their lochia was all of a sudden suppressed. Suppressed lochia causes a depression. Physical symptoms suppressed and mental symptoms increases. In aphorism number 38, example number 4, Hahnemann gives the example of tuberculosis, where the thysis in the lung wall all of a sudden decreases and mental symptoms comes up. Okay, so you will see, you will notice these things nowadays also. It is not that that this is something 200 years old. This is the matter of observation. Okay, the facts which Hahnemann observed at his time is still valid after 200 years. Why it is still valid? Because it is not giving the possible explanation to that. Clear? It is not given possible, it is not giving possible explanation to that phenomena. It is noting down the phenomena as it is. Okay? And you have to just match this phenomena with your symptoms of medicine and give medicine. If Hahnemann used to give some explanation to that phenomena, it would have been discarded now because of the development of science and the advancement of the science in the field of medicine. Okay, this is the beauty of Organon. What is making Organon timeless, or the timelessness of Organon is due to its observational facts. Okay, what Hahnemann have seen, have recorded, and still you can observe that. Don't you observe this postpartum psychosis where the physical symptoms all of a sudden decrease? Can't you observe the asthma increases after the suppression of external eczema, after the suppression of dermatitis? Can't you see these still now? Yes, it is valid still. Okay, so it is not that Hahnemann, it is not that the Organon is of 200 years old. Organon is, most of the part of Organon is timeless. Okay, but you need to interpret that old terminologies in the light of modern development. Like we have already at many places have discussed that masked venereal diseases. We don't think of this in this modern age that you will get any masked venereal diseases. But yes, you will get some artificial masked diseases. What is masked venereal diseases? Actually, masked venereal disease is SORA with combination of syphilis treated artificially by an artificial disease of mercury due to wrong treatment with mercury. So SORA, syphilis combination plus this artificial disease of mercury. Nowadays you will get artificial disease of steroid, artificial disease of antacids, artificial disease of NSAIDs. All these are possible, and you will get in your observation these things. Artificial disease of steroid is so common nowadays that the use of hormonal pills and use of steroids are so common nowadays that you will every now and then will get a case complicated with the steroidal side effect or hormonal side effects. Okay, and under the mask of that artificial disease lies the original disease. Okay, so this is the timelessness of Organon. Organon is timeless because of its factual documented. Because of the facts are documented. Hahnemann have not gone into the possible explanation of that phenomena, rather noting down the phenomena itself. Okay, and you have to match. Hahnemann have given emphasis on the symptoms, and you have to match that symptom with the symptoms of your provings. And this is the application. Key business of the physician: knowing the what is to be cured in disease, not knowing that why this disease happens. You should know what is there to be cured. There is headache, there is possible fever, there is possible pain here and there in the body, there is possible redness of the eyes. You have to know these things should be cured. These are not normal. Now you have to know what is to be what are the things you can utilize in the medicine, what are the symptoms of medicine you can utilize. And now this is the application. Third business, the correct application of these two knowledge. Here these two knowledge, one-sidedness occur from the part of lacking symptoms, only two symptoms you are having, this is called one-sidedness. Okay, or only few medicines are available, this is called when the first case we have read, when there is lack of number of medicine. Okay, This is also one-sidedness of medicine. You are not knowing number of medicine, ample number of medicine. So you have to approach in different way. But if you know this properly, if you have this properly, now the application is easy. Okay. So this is making Organon timeless. Now the cases are not rare in which so-called corporeal disease that threaten to be fatal, a suppuration of the lungs, that is phthisis, and when I have already given example in 38 footnote, and you will get articles, you will get cases, recorded cases in modern days article also, that phthisis changes to mania, or mania, after mania phthisis comes, or tuberculosis comes, or deterioration of some other important viscous. You will see the what it is, the hepatic neuropathy, where the bilirubin increases so and so that the patient is suffering from hepatic psychosis, that is the mental symptoms of excess bilirubin is being deposited in the brain, and mental symptoms, psychosis is coming. So these are the cases you will observe, you can still observe. Okay, this is not that it is not happening nowadays, because it is fact, and facts are like mountains. It was there 200 years ago, it is there after 200 years. So some other disease of acute character, that is in childbed, etc., becomes transformed into insanity. Corporeal disease, underline that, become transformed into insanity, into a kind of melancholia, or melancholia, that is depression, postpartum depression, or into mania by a rapid, mania is psychosis, mania by a rapid increase of psychical symptoms that were previously present, whereupon the corporeal symptoms loses all their dangers. Underline this. Corporeal diseases become transformed into insanity, and corporeal symptoms loses all their dangers. These later improve almost to perfect health, or rather they decreases to such a degree that their obscure presence can only be detected by observation of a physician gifted with the preservance and penetration. Okay, in this manner they become transformed into one-sided, underline this, and as it were a local disease in which the symptoms of the mental disturbance, which was first but slight, increases so as to be the chief symptom. Underline this. Underline transformed into one-sided, symptoms of the mental disturbance, which was first but slight, increases as to the chief symptom, and in the great measure occupies the place of the other corporeal symptom. Underline this. Whose intensity is subdued in a palliative manner. Whose intensity? It is the intensity of the physical symptoms. Okay, so that in short affection of the grosser corporeal organ becomes as it, so that in short affection of the grosser corporeal organs becomes as it were transformed and conducted to almost spiritual, mental, emotional organs, which the anatomists have never yet and never will reach with the scalpel. Okay, that is the transformation of corporeal disease to the level of mental and emotional disease. Okay, now 217. So you must have underlined those things which I have told, and this consists the definition of first type of mental disease. Okay, first type of mental disease. It is from corporeal to mental. Okay, that is, you cannot say it exactly somatopsychic, but yes, possible. You can possibly, to better understand it, you can call it somatopsychic, but don't use the term in front of your viva examiners if you are in post graduation or if you are in your undergraduate. Don't use this somatopsychic. For possible understanding, easy understanding, you can use term somatopsychic. Okay, psychosomatic and somatopsychic are totally a different set of disease, should be read separately from this from what corporeal to going to mental. Okay, that is a different set of disease. A bit for understanding purpose, you can say that this is somatopsychic, going from body to mind, somatopsychic, or psychosomatic, going from mind to body. Okay, but those are different set of diseases, should be read, should be encouraged to read separately. Now 217. Now this definition occurred, definition of mental disease in 215 occurred. These aphorisms are in chain. 216 is giving the first type of mental disease. Now 217 starts with the case taking or treatment. See, in these diseases we must be very careful to make ourselves. Everywhere you will see that Hahnemann is firstly defining the problem, next the giving the solution to that problem. In intermittent diseases, Hahnemann is defining intermittent disease, now possible types of intermittent disease, now case taking of that intermittent disease, now repetition of medicine, what medicine to give, what symptoms to take and what medicines to give.